Hi ma'am, I'm having some discomfort in my lower belly, and when I'm going for the urine, I'm continuously it is increasing some
The pain.
discomfort, discomfort and pain,
Okay.
both. And I have consulted so many doctors. They done so many tests, but there
Okay.
is in that test there is negative. But
There is no infection. That is what you mean to say.
there is no infection, but my pain is not getting reduced.
Okay. So has the symptom been there for like more than 6 weeks or so?
Yes,
Yeah.
yes ma'am.
So this condition, in the absence of urine infection, see, when we say the symptoms of burning or pain or frequency of urination, it is usually the first thing that comes to our mind is urinary tract infection, what we call UTI. But in the absence of infection, as you are saying, if the symptoms of pain, burning have been there or some kind of discomfort, they have been there for quite some time, like 6 weeks and above, we call it a condition called bladder pain syndrome. So this condition is quite common now,
Okay.
but it is mostly treated as urine infection, and somehow the symptoms will reduce for a while and then they again flare up. So that is what you are
Yes,
telling
yes,
me.
ma'am. The
Yes.
on medication it is getting reduced, but after stopping the medication, again it is increasing.
Okay. So let me tell you the reason why it happens. Maybe
Okay.
some time back you might have had some kind of infection which did not get treated completely.
Okay.
So the damage which remains inside, although the infection is not active, the damage will continue. And that is where the protective layer called gag layer inside the bladder lining, which usually protects our body from the invasion of bacteria, that is getting damaged.
Okay.
And that is how the nerves which actually make us perceive the pain, they get kind of exposed, and that is how this pain remains. And as the bladder is getting filled up, the pain worsens. So even when you are passing urine and a while after passing urine also, you might feel the pain.
Yes, yes,
So the pattern can be very different and at different points of time.
But what is the reason, ma'am?
Yeah, that is what it is. Sometimes an insult or injury in the form of some infection, or some occasionally autoimmune disorders also, which can make this happen. But as I understand, you do not have any risk factors and autoimmune problems with you.
Yeah.
So it is mostly some kind of infection some time back which did not get treated completely.
What is the treatment options?
Yeah, there are treatment options, but I should tell you that treatment is not like magic treatment that you take one medicine and it will completely stop. There is some time it takes because the damage has been there for a while. So there are different types of treatments. Usually it is simple in the form of some tablets which are nerve calming medicines for a while, but these are not habit forming. So, and during the process of this calming down the nerves, there is also some healing that we give to the inner lining of the bladder. So that can be done in the form of some medicines which can have to be given over a period of 3 months to 6 months, or there is another pattern of treatment called bladder instillation,
Okay.
where we make a mixture of medicines and instill it directly inside the bladder with a small pipe or a tube or a catheter, and that is put under lubrication under all aseptic conditions. So there are no chances of infection, or you might fear that some pipe is being introduced so it will cause some problem pain. Usually it is not so. It is a very small size soft tube put with lubrication. So the pipe goes inside and we put all the drugs inside and let them stay in for an hour or two. That is how the treatment happens. So we have to do some 4 to 6 times the same process. And that is a very good treatment option.
So
And
duration will be like for how many months
yeah,
or days?
it is not the same for everybody. Usually it takes a month for the relief to be seen significantly. If we are starting the treatment before the disease is advanced, you will be relieved completely in say 4 weeks itself. Few people need it for 6 weeks, few people also need it for 8 weeks occasionally.
Okay. Ma'am, what will be the test? I have
Yes.
done already some tests.
Yes.
But
So the thing is, tests are not absolutely necessary. The only important thing we do is do a urine examination and culture to rule out infection, and then we start this treatment. In few patients occasionally we need a test called cystoscopy. Cystoscopy means we put a telescope inside the bladder and see the extent of damage, and accordingly we may plan the treatment. But it is not an absolutely necessary test to start the treatment.
ma'am, is there any complete relief to this problem?
Yeah, that's a good question. So there is definitely significant relief, but we cannot say that it is 100% relief, and also we cannot say that it won't happen again.
Okay.
So there are certain dietary triggers and certain environmental triggers or some emotional triggers like stress-induced problems. So these can lead to flare up of these symptoms. So there are certain definitely lifestyle changes that you would need to follow, and we would be able to give you close to 90 to 95% of relief, which is not 100, but there is a very good and a significant relief from your point of view. When you go through this treatment, which many people have taken, and they're really happy about the outcome.
Ma'am, it will
Yes.
be, my question is that again it will repeat like this problem.
So there is a likelihood that this problem repeats, but the remissions can be very long. I mean, you can increase the duration between subsequent flares, and you can reduce the intensity of flares by certain lifestyle changes. And there are certain dietary triggers, as I said. So few people do not go well with spices or with certain types of salty things or sour things. So we have to identify those which are specific for each individual, and then you have to eliminate from the diet. So that is how you can keep away from the problem for a very long time. And of course, infections can happen in between, which can also flare up. So you have to make sure that you are keeping yourself safe from urine infections.
Okay, ma'am. So by this, by your what statements and everything explanation, now I believe that I can go through my problem very soon.
I hope so too.
Thank you, ma'am.